The chair recognizes Mr. Turner to explain the amendment to the amendment.
Thank you, Mr. Speaker. Members, this is a pretty straightforward amendment. If you've served in this body before, you've seen a similar amendment in the past. And basically what this amendment does, like Mr. Leach said in his amendment, he's trying to address needs that are not being met currently. This amendment to the amendment would also address needs that are not being met currently in the state of Texas. Currently, we have over 5 million uninsured Texans. We're a leading state when it comes to the leading state when it comes to the number of uninsured and the rate of uninsured. We lead, unfortunately, in maternal mortality rates. The last decade, the state has consistently rejected tens of billions of dollars in total. Dollars that would provide vital health coverage to more than 1 million Texans, adults, children. We know that increasing access to care saves lives. According to the 2022 study by the Texas Maternal Mortality and Morbidity Review Committee, about 90% of pregnancy-related deaths in Texas in 2019 were preventable at some level. That's an issue that our colleague Representative Rose has worked very hard on, among others. According to the National Library of Medicine, expanding Medicaid is significantly associated with lower maternal mortality rates. Not only that, but increases access to preventative care that results in Texas hospitals saving $360 per patient. That'll decrease hospital inpatient costs by millions of dollars each year. In every state, every state that has expanded Medicaid, children have gained coverage alongside their parents. When Virginia began Medicaid expansion enrollment in January of 2019, for example, more than 25,000 children were also enrolled in Medicaid and CHIP. Here in Texas, a Texas A&M Bush School study estimates that if Texas expanded Medicaid, 954,000 newly eligible adults would enroll in expansion, bringing approximately $5.41 billion in federal dollars annually to this state. Members, this body has continually...
Mr. Busey, for a purpose.
Will the gentleman yield for some questions?
The gentleman yield for questions.
I'll be happy to yield in just a moment.
In just a moment, Mr. Busey.
We have, unfortunately, continually voted against Medicaid expansion for the last 10 years. We are now one of only 10 states in the country that has not expanded Medicaid under the Affordable Care Act. North Carolina was the most recent state to join 39 other states in expanding Medicaid because they recognize it's the right thing to do. And these are red states, there's blue states, there's purple states, there's all color states that are expanding Medicaid because they understand it makes good economic sense, it makes good health care policy, and it's the right thing to do for their citizens, like it is the right thing to do for our citizens in the state of Texas, and that's why this body should vote for this amendment to the amendment. I'll be happy to yield.
Mr. Busey, for what purpose?
Will the gentleman yield for some questions?
Will the gentleman yield for questions?
Yes, I'll be happy to yield.
The gentleman yields.
Mr. Turner, I know it's late. This is a very important amendment. There's a lot at stake here. I just want to drive home a few quick questions to make sure the body understands what's at stake with this amendment. How many Texans would Medicaid expansion help in this state?
It's estimated that it would benefit over 1 million Texans.
When we say over 1 million, these are working Texans. Is that not correct?
That's right. And I believe that one of the most recent estimates is 1.4 million working Texans.
And when we talk about working Texans, we're talking about people that make too much to get health care since we haven't expanded, but not enough to actually afford health care on their own. These are working Texans that help our community. Isn't that correct?
Well, that's exactly right. These are people who work each and every day. They go out, they support their families, but they don't have health insurance for whatever reason through their jobs, through their employer. This is about helping those Texans that are fueling this economy. We've heard a lot today and a lot this session about how strong and great our economy is.
Members, please take your conversations outside the chamber.
Our economy in the state is strong, and it is great. It's great because of the working men and women who power this economy every day, but 1.4 million of them, at least, do not have any health care right now.
In addition to helping 1.4 million working Texans, how much in federal dollars would we bring home over the course of a decade?
So it's a great question, Representative Busey. This is, there's a lot of different federal programs that have different matching rates. This is one of the most, if not the most generous federal matching programs. It's a 9-to-1 match. So let me repeat that. For every $1 the state of Texas puts in, we will draw down $9 in return. I'm not an economics major, but I think that's a pretty good deal. I think that's a pretty good deal for the state of Texas, and it's estimated that it would be roughly $5 billion to $6 billion per year Texas would gain from expanding Medicaid.
I got two more quick questions for you. Do you know how Texas compares in healthcare access to other states in the nation?
We compare very poorly compared to other states. We have the highest number of uninsured in the country with over 5 million. And you might say, well, that's because we're a big state. Not entirely. We also have the highest rate of uninsured. That's the highest percentage of our citizens are uninsured. Over 18% of Texans have no health insurance. It's unacceptable.
Let me ask this last question. I think it's important that everybody in the body understands this, because when I talk about Medicaid expansion, anywhere I go, this is a confusing point for most people. But this was a federal policy. It's not a state policy. We decide to participate or not participate. So there's my question. Don't we already pay these taxes, whether we get the benefits of them or not?
You're absolutely right, Representative Busey. We are paying, and we have been paying taxes to the federal government over the years while this policy has been in effect since it was passed more than a decade ago. And we have just forfeited those tax dollars. We have forfeited Texans' tax dollars by refusing to participate in Medicaid expansion just to make an outdated political point. So those taxes are already being paid. They will continue to be paid. We are just being incredibly short-sighted by not taking advantage of this opportunity that Texas has, and we have the most to gain of any state in the country, the very most to gain by expanding Medicaid, and we're now one of only 10 states that has not yet done it.
Thank you, Representative. Thank you, Mr. Speaker.
Move adoption.
Mr. Turner sends up an amendment to the amendment. The chair recognizes Mr. Leach to speak in opposition to the amendment to the amendment.
Thank you, Mr. Speaker. Members, I'm not going to belabor the point. I hear you. Chairman Hunter, we're going to vote in just a sec. I'm going to oppose this amendment, members, simply because if we want to have a discussion about lowering health care costs for Texans, which all of us do, which this House has led on, there are many good ideas that are going to hit the floor over the next 2 months and the remainder of session, but this is not the way to do it. This amendment, my amendment, is about the A2A program, about filling a $25 million shortfall. If my colleagues wanted to have filed an amendment expanding Medicaid, they could have done so. They failed to do so on the bill, and they thought that my amendment would be a good vehicle to do so, but I'm not going to let it happen. So I want to oppose it. I'm not going to ask for a motion to table. I'm just going to oppose it outright and ask for you to vote no on the amendment to the amendment.
The chair recognizes Mr. Turner to close on the amendment to the amendment.
Thank you, Mr. Speaker. Members, I think we come to this floor to try to solve problems facing our constituents, facing our states. Mr. Leach has brought an amendment that he's trying to address what he sees as a problem that he's trying to solve. I'm bringing this amendment to the amendment to address what I think is an even bigger problem, but a very related one, and that is people don't have access to the care they need in this state because we have not expanded Medicaid under the Affordable Care Act. So let's not go another 2 years being one of only 10 states that has not expanded Medicaid. I would predict that if we do not adopt this amendment, we'll come back here in 2 years and we'll be one of less than 10 states that's not expanded Medicaid. Let's not be in the bottom 10. Let's do this right now. Let's get this done. Let's expand Medicaid under the Affordable Care Act and bring health insurance to more than 1.4 million Texans this year. Let's draw down $5.4 billion in federal funding this year, and let's do the right thing for Texas.
Mr. Turner,
that you vote yes on the amendment.
Mr. Turner sends up an amendment to the amendment. It is not acceptable to the author. Mr. Turner has requested a record vote. The record vote has been granted. The clerk will ring the bell. Show Mr. Turner voting aye, Mr. Leach voting nay, Mr. Harris voting nay. Show Mr. Toth voting nay. Have all members voted? There being 65 ayes and 83 nays, the amendment to the amendment fails to pass.